Hello guys, Assalamu alaikum. This is Dr. Faraz Ahmad, and today in this video we are going to discuss about the doctor's job, salary packages, criteria, exams of UAE. So I have done a lot of work, so let me discuss these things with you. So guys, after the COVID-19, almost every country is facing high rates of the inflation, and so working in those countries which are tax free are desired these days. Almost every professional is willing to work in the countries like UAE, Saudi Arabia, other Middle East countries where there is no tax. They are totally tax free. So there are 7 states of UAE, and for those 7 states there are 4 type of tests which are being held these days for to work in those states. So there are 2 tests for Dubai, 1 test for Abu Dhabi, and 1 test for rest of the 5 states. Okay, so let's discuss them one by one. So before discussing these tests, before discussing the salary packages, let's talk about the eligibility criteria. What are the eligibility criteria to work in the UAE? So first criteria, you should have MBBS. That's obvious. And apart from the MBBS, you should have 1 year of a house job. This is obvious as well. But the third criteria that is very important. After MBBS, after 1 year of a house job, you should have 2 year of post house job experience. 2 year of post house job experience is very important if you want to work in the UAE. But if you have not experience of 2 year post house job, if you have pleb 2, if you have cleared USMLE, if you have cleared MRCP, and if you have cleared the Canadian exam, then you can go to Dubai without any hesitancy. Okay, so as I have mentioned, 7 states and 4 type of exams. So let's discuss these exams one by one. So the most difficult and the most standard exam in the UAE is the HAAD exam. So this is the most difficult exam and the most expensive one as well. You have to pay 3,000 dirham of UAE. That is the fee of this exam. So let's discuss about this exam. So basically this exam is conducted for Health Authority of Abu Dhabi. HAAD exam is basically Health Authority of Abu Dhabi. Alright, so what is the pattern of this exam? In this exam, first of all, you will give the written exam in the form of the MCQs. There will be the 100 MCQs and there will be 90 seconds for each MCQs. That's mean you will have to complete 100 MCQs in 2.5 hours. Alright, and keep in mind, marking criteria is also very different. Like marking criteria differ from country to country. Like if you are from Pakistan, criteria is different. If you are from India, criteria is totally different. And this HAAD exam is valid for 3 years. Okay, and the other thing which is important, if you have failed the exam, you will have to wait 3 months to reappear in this HAAD exam. After this written exam, you will have to appear in the oral or the viva exam as well, and there is a OSCE exam as well for the HAAD exam. This is the reason I have mentioned this is the most difficult exam for UAE. The other exam is DHA exam, which is called Dubai Health Authority exam. MCQs based exam, only 70 MCQs in 2 hours. After this, a very small viva oral exam, no OSCE here for DHA exam, and this exam is valid for 5 years. HAAD exam was valid for 3 years and DHA exam is valid for 5 years. And please keep in mind, if you have cleared the DHA exam, you will be able to practice in the city of Dubai only in the city of Dubai you will be able to practice. After this, the third exam is DHCC exam. This exam is basically licensed by the Harvard International, and this exam is called Dubai Health Core City exam, DHCC. Alright, again same pattern, 70 MCQs in 2 hours, very little viva exam and no OSCE here. OSCE was only for HAAD exam. So this DHCC exam is also for the Dubai, which come under the Harvard International. Only the hospital which come under the Harvard International in the Dubai, you can work there after clearing the DHCC exam. There is a MOH exam, MOH exam, and this exam is valid for 5 states of UAE. The rest of the 5 states, if you want to work there in those 5 states, you will have to clear what? MOH exam. This is called Ministry of Health examination for doctors. All right, so again pattern is the same, 70 MCQs in 2 hours, very little oral exam, no OSCE here as well. So after clearing the exam, you will apply for the jobs. Like if you want to apply, if you have cleared the exam of the MOH, Ministry of Health exam, so you will clear in the hospitals which come under the MOH. Okay, so if you have cleared the HAAD exam, you can only apply for the jobs which come under the HAAD. All right, so like you have applied and you have secured a job. So what is the salary? How much you can earn in the UAE? You have cleared this exam and you will start working there. What will be your status? So you will be working as GP, general practitioner there. So what will be your salary? So after MBBS and after clearing these exams, your salary will be almost, an average salary would be 22,000 dirham. 22,000 dirham will be your average salary there. It can vary from area to area, from hospital to hospital, from state to state, and your incentives and all other benefits could also vary. But an average salary is 22,000 dirham after MBBS and after clearing these exams. All right. So if you have done the MRCP, so how much you can earn there in the UAE? So keep in mind, you can earn up to 50,000 dirham per month. Very, very handsome salary. If you have done the MRCP, you can earn up to 50,000 average salary per month. The other thing I would like to mention, if you are a consultant or if you have done some FRCP or FRCS, you can earn up to 70 to 80,000 dirham per month. So this is not only which you can earn there working in the UAE. The other thing you can earn is that a lot of benefits. That's mean you can get accommodation, you can get allowances, you can get travel allowances, you can get the education expenses of your children, you can get the travel ticket to your home once in a year. So a lot of perks or benefits you can enjoy along with your salary while working in the UAE.